Life365, and welcome to Season 3 of The New Normal. Today's episode will discuss the necessity to provide health and care at home. We will review the various services needed to enable care and recovery at home. Before I introduce our panelists, I wanted to take a minute and thank you for joining us today, as well as thank our panelists for sharing their time with us this afternoon. As for the structure of this webinar, attendees will be on mute and we'll have reserved time at the end for questions. Please place your questions within the chat. You can review the recording on today's webinar on newnormal.buzz. Just a brief introduction of kind of what we're going to be talking about today, some stats behind it. 39% of Medicare enrollees have 4 or more chronic conditions, which include conditions like diabetes, heart disease, and chronic kidney disease. Many of these patients also have undertreated behavioral health conditions and unmet social determinants of health like unstable housing, food insecurity, and lack of transportation. Combining services to provide comprehensive all-inclusive care is the full stack. These complex care patients represent about half of all healthcare expenditures, with a high cost of care for this vulnerable population. Finding a full-based solution that helps manage their needs where they are is critical, especially since 88% of seniors would prefer to receive care in their home. Now I want to introduce our distinguished panelists. First off is Geoff Gross, CEO and founder of Medical Guardian. Geoff is the founder and CEO, a leading provider of Medical Guardian, a leading provider of personal emergency response and connected health solutions. Founded in 2005, Medical Guardian protects over 300,000 active subscribers nationwide. Geoff's passion for the connected care, age tech, and IoT industry is the basis for the mission of Medical Guardian, to empower customers to live a life without limits. With 17 years of experience in healthcare, Geoff has positioned Medical Guardian to empower its customers through innovative products and services that offer protection at home and on the go. Next is Donna Zazworsky, manager and healthcare consultant. Donna provides expertise in community collaboration and care coordination. Previously, she was a director at Arizona Complete Health. She provided administrative oversight for the integrated adult and children care management programs, disease management, and their respective access deliverables. In her previous position as VP for Community Health and Continuum Care at Carondelet Health Network, a faith-based healthcare network serving Southern Arizona, she was responsible for integrating and bridging transitional and care coordination across acute care, outpatient, primary care, and community settings. Ms. Zazworsky is an adjunct clinical associate professor, University of Arizona College of Nursing. She serves on local and national boards and has numerous community and professional awards for her service, including one of Tucson's 10 Women of Influence. We'll also be joined in just a little while with John Barto, who is Chief Transformation Officer and Healthcare Evangelist for Microsoft Health and Life Sciences. John is a true visionary at applying technology to solving healthcare challenges. John gained much of his hands-on experience early in his career when he was CIO, responsible for developing, deploying, and managing all the information technology assets and personnel for a county hospital in Central Ohio. Building on this foundation, he went on to architect and develop the first preferred provider organization PPO ranking system for Blue Cross Blue Shield of Michigan, helped build small to mid-sized healthcare information system providers, and developed health management maintenance organizations, HMO, systems under a consortium of HMOs in the state of Michigan. Since joining Microsoft in 2010, John has focused his energy on helping healthcare organizations create engaging experiences focused on health consumers, employees, and affiliates that are injected into daily workflows without creating additional effort to their targeted audiences. So, I really want to start out, let's start out with you, Geoff. We've been talking a lot, you've been in the PERS industry for a while, about combining PERS with remote patient monitoring. What's Medical Guardian's philosophy of getting into the RPM space and the necessity for it?
Well, it's really about providing more value. We sit at this really interesting point in the lives of older adults where their needs start to happen. Typically, our customers come onto our service at 77 or 78 years old, stay with us about 4 years, generally 2 years before there's a need for home care, 4 years before they need to move into assisted living or a facility of some sort. And, clients, patients have general worry all the way to falls have happened, medical emergencies, and certainly chronic conditions. I would say over half of our customers have one chronic condition. More than that, I'd say over half have two is what I meant, and the large majority have one. So that's really got us thinking about, remote patient monitoring, vitals monitoring in particular, and how we extend more services into the home. So we hear these popular terms now, hospital at home, of course, but really healthcare at home. And you see just more convergence of sort of this home care element with PERS, which to this point has been about reactive protection. So an emergency happens, we react to it, we get someone help quickly, which is valuable in the sense that it allows them to stay living in their home independently for many years longer because they don't tend to spend a week or two in the hospital. While if that emergency is extended beyond, call it 5 hours, it's directly affecting their long-term health. And then what happens after that is dramatically different and more expensive. So being able to stay connected to someone in the home, not only manage emergencies, but also attack sort of more important topics of the day, which are social isolation, depression, loneliness, that lead to not only mortality rates increasing, but hospital admissions, readmissions, certainly, and being able to monitor all that on a consistent basis and certainly daily is very important to us. And I know it's important to our customers to look to companies to offer that bundled service. And we hope to be the company that they turn to for those needs.
Just staying with you for a second, you also, it's public information, you guys just acquired and merged in with MedScope, right, from that. And with that comes, I think, a large number of HCBS contracts or and endpoints. What is the advantage of bringing MedScope together with Medical Guardian?
Yeah, and I'm sitting in the MedScope office now, which lucky for us was only about 35 minutes down the road from our Center City, Philly office. So there's been a tremendous amount of work put together in bringing very almost identical products and services, but two very different channels as far as the acquisition of customers and patients and the servicing of them and the needs of them. Certainly the payers are different, whether it's private pay or direct pay. And what we're seeing in our Medicaid relationships and similar, even our home care relationships is just an increased awareness of what a company like us can offer. And certainly, as I mentioned before, a desire to turn to one company for all of those needs, whether it's emergency response or medication management or vitals management. That is something. And of course, the reimbursement landscape is different for those needs. But I think as the years go along here, we're starting to see a convergence of that.
Awesome. Donna, I want to go over to you really quickly. You have experience both on the provider side and also the payer side, right, as well. And let's just talk about the provider side, from that perspective. Are the health systems ready for patients to go home, right? And on the hospital at home initiatives, and what can be put in place to be able to help make sure they're secure? I'm just going to interject really one thought into this really quickly is that, with the hospital at home initiatives that are out there, I think it's the responsibility of companies coming together like Medical Guardian with remote patient monitoring to make sure that those environments are safe to transition patients home, that they have the call button, that they have the vital signs, they have the food, medication, transportation. What has been your experience in adoption and transitioning home and actually the clinician working with patients that are at home?
So thanks, Kent. And thank you for inviting me to be on this panel. So, from my experience of working in the hospitals and with the primary care providers, it's a matter of knowing the population. So let's say we're working with that Medicare population. One of the things that we had done, several years ago in the hospital setting was looking at that whole care transition process and what is in place with that. So, taking a look at what kind of funding was available, being able to put a care transition program in place. What I would say is that, working with, knowing the population, working with your partners, your providers, because again, we were able to set up the remote patient monitoring in the homes for those patients that had congestive heart failure, COPD. We partnered with our area agency on aging. They helped with the PERS system. And, we had nurses. So, in some situations, home health would be going out. And working with that person in the home and engaging them. I think what's critical is that you set up the system that's going to be appropriate for that person. So do they have a caregiver that's going to be able to manage helping them with weighing themselves or checking their blood glucose and having it uploaded in the system? I know we would send people out in the home. We had community health or our outreach workers, promotoras, that would go out into the home and help that person get set up so that they would know how to manage it. And if they had problems, we could help problem solve over the phone or go out into the home. I think that's the kind of partnering that has to occur so that this can be successful from going from a hospital to a home situation, and helping move that person out of the hospital sooner and being managed in the home. Definitely having the providers on board, helping set up those guidelines so that the providers can say when is the best time for them to be notified for these out of range, when the weight goes up for heart failure, when the oxygen drops on this person, or when their blood glucoses are out of range, what are those next steps? Those are things that we worked with our providers and actually put together action plans, kind of that stoplight, red, yellow, green, and would teach the patients on how to identify when they needed to call the nurse, when they needed to call the provider. So setting up those kinds of things, gauging where that patient engagement is. And in some situations, it might be, what are the incentives? What are the incentives for the providers? What are the incentives for the patients as well?
Awesome. I'm going to come back to you on your payer side just in a second, but I want to ask John. John, you've been at Microsoft for a while. You've been out on some major health systems as well. What is your thought on actually rolling out connectivity to the home? I know Microsoft has an initiative called Microsoft Cloud for Healthcare to now start connecting providers frictionlessly to their patients, right? And using technology to try to transition care to home. What's the Microsoft initiative around that?
Well, there's a few things going on, Kent, from our perspective. Number one, we do have capabilities and technologies that we're offering to health systems to roll out capabilities to home. In fact, you're a great partner of ours that helps us do that as well. We're seeing a lot more requests coming in for home-based reporting and those types of things. And we're also seeing some of the challenges that are going on. So we also try to cover rural areas, places that don't get coverage as often. And there's all kinds of bandwidth issues out there. And so we've got some initiatives going on at Microsoft to help with bandwidth by using the white space and TV signals and stuff like that to get bandwidth to places so that we can actually keep people at home, care for them there, and basically have the bandwidth we might need to carry the signals back and forth. We're also seeing some strong interest right now in some of the smaller device cellular kind of networks, as opposed to being connected directly up to a device at a home that would report back. We're seeing that kind of initiative as well. So we're getting lots of requests in this area. And the other piece that we see on the other side of it is, once you get the signals from the homes and when you're trying to communicate with those folks, how do you use a communications platform to do that? We've got some tools and technologies in that space that are being very helpful to a lot of our clients.
Yeah, it's interesting. I'm starting to get immense feedback that when we're approaching health systems, people know that it's hard to get into health systems. They know they have to go try to open the door. They know they have to go try to get a pilot done, potentially a contract negotiated, integration done. The one thing I like about the Microsoft side, and this isn't an advertisement for Microsoft, is that you're integrated already into 300 different hospital or enterprise customers, and you already have the ability to have contracts with them already. Yeah. So people that are coming on board to your platform, especially like even a PERS functionality, allows you to get behind that firewall quicker, right? And to implement quicker as well.
Yep.
Geoff, from your perspective, when you're reaching out to customers, are they now requiring you to have not only a PERS device, but an RPM device? What's their thinking from an enterprise perspective?
No, I wouldn't say requiring, certainly not requiring. There's dramatically more interest than there used to be in such a thing. And in some cases, it's a prerequisite to earning that business. But we believe that it's going to continue to go in that direction and truly be a differentiator. I mean, we've seen in the last few years just how many, COVID accelerated RPM to a point where it's hard to just comprehend the differences of each solution, whether it's cellular-based peripherals or clinician aspects of RPM, and I think the needs of different health systems, healthcare organizations are sort of end to end. I mean, you really have to align with the partner that you're talking to, and I think that creates more optionality in the marketplace, which is exciting. That should benefit the patients in the end and provide more value. So we're getting prepared for that, and the last 12 months have allowed for some clarity around what the needs of the future are going to be, certainly, but I think everybody's still figuring it out. And for us, it's really about continuing to provide protection at home, but also a healthier outcomes at home, and tying into the chronic conditions that, of course, we all mentioned, but also when you talk about sleep and eating and just general activity, that's important to us. We've progressed in our category from home to mobile to wearable devices. This is our new wearable called the MG Move, which is designed to address the social, cognitive, and physical well-being of a person. So really the whole health. And we have different features on top of course, its core feature, which is emergency response, being able to get help anywhere you are with our GPS function. And it's built for future fall detection capabilities. But at its basic level, it has messaging and reminders, so we can do medication reminders. It has weather. As we were warming up with each other in the beginning, it's odd we'll get an 80-degree day in Philadelphia these days, but it's nice to go on the lawn and be able to see what it's like outside. And then, of course, activity. This is our entry into monitoring and setting goals and some light gamification around that for just getting seniors up and out and moving better than they would have otherwise. Certainly what we've been through the last 2 years.
Do you envision that a device like the MG Move would potentially connect to other devices and send data to the cloud for their providers, like for blood pressure or weight or glucose?
Absolutely. Absolutely. It doesn't today, but that's certainly the idea, and doing it in a way that's reliable and affordable, and simple in nature. I mean, that's, there's complex solutions all over our category and similar. And, we've seen really interesting, well thought out products with bells and whistles. What we always try to do is determine what's scalable, what do most people need, and how can we serve it up to them in a way that's affordable and certainly reliable. And that's always a balancing act, even when you take a device like this. One thing that's very important in smartwatches, where the broader market understands, is battery life. When you're dealing with an Apple Watch made for you and me and everyone else, 8 to 10 hours does the trick. When you're talking about an emergency response system that you really need lasting all day at the minimum, that requires, in today's world, with the form factors that we're all trying to achieve, certainly a balancing act and a compromise with other needs and desires. So we're getting there, and I think connectivity with peripherals is available now, and certainly will continue to be enhanced over time.
Yeah, so you can actually build the stack into one offering, so they can actually scale up from what they want. That's
see... right, and we think PERS is the entry point to that stack of services with RPM and home care and teledoc and nurse and everything else that comes along with that. It's pretty exciting for what I believe the consumer, the patient, will be able to access in their home over the coming years versus the previous 5.
I always go back to a story about my parents when we moved them from the farm in Iowa to independent living. And we're 1,500 miles away, you usually get a PERS device when there's an event in the family as a starting place. We would love to have a place where we could have built upon it, where we could actually move them into independent living instead of assisted living, save $4,000 a month, but give them access to RPM and telehealth and monitoring and in-home services like food or, you know, maybe non-emergency transportation. All that stuff would have been great for our family to invest in at $400 or $500 a month, you know, versus $4,000 a month, right? And
Well,
I'm not saying that PERS is going to scale up to that, but we would gladly have paid that to keep them in their home.
well, and the starting point is penetrating the addressable market with PERS better, and that's been something that the industry in general has had trouble cracking the code on the last 40 years. We believe that it's a combination of perception issue and a product and service issue, which we've been chipping away at the last several years, and we believe that the category is increasing in its penetration, and we're at the forefront of that with our innovation and focus on customer experience. But with best estimates, 7 to 8% of 70 and older who live alone having some type of personal safety device on them, that leaves us with 9 out of 10 who don't, and that's considerably less than the homes protected in our country. So that's to say, if you're a senior with medical conditions and fall risks, you're more worried about someone breaking in the house than you are falling and tripping on the rug. So, we're here to change that, and we think our messaging campaign and our product roadmap is going to help us achieve that success. Yeah. And that will lead to the rest of the stack that we're also interested in.
Thanks. That's great. Donna, I'm going to go back to you for the payer side. But one of the things that I keep on going back from the PERS side, is there are models like, sorry, John to mention, but Amazon and, Transcarent that's out there that they bought 300 surgery centers, right? And they want to be able to send people to a surgical center instead of taking them in the hospital. But they don't know if the home is safe and secure, right? To be able to send people home. And does it have, vital signs and everything else with it? I think the combination of PERS plus RPM gives these trillion-dollar opportunities that are out there in transition care from hospital to home, gives people the comfort that they can safely transition people there. So Donna, that's just my point of view. Donna, I wanted to go to you from the payer perspective. A payer, even a provider gets, actually approached from multiple different vendors all the time. They may get a disparate, system for RPM or for PERS or for food or for care or for other things. How important it is when you're looking for vendors now that they are bundling them on one platform and trying to meet and personalize the services for that individual?
So I think, understanding, from the plan perspective is that we're looking at our population, again, going back to knowing what our population is and what are those needs of that population and how best to deliver that. So if I have a population, let's say the Medicare population, it's a Medicare Advantage population, then I'm going to look and say, okay, where are those highest risk members and what are going to be the best ways to address those members? So, we have care management programs, case management programs. We're going to set up some kind of risk stratification. We're going to take a look at how best to engage that member into these services and who best to partner with to do that. Because as a plan, you're not necessarily out there with that person in their home. And you need that capability, depending on what their skill level is, on will they be able to manage all those different modalities. So, it's one thing if they're very competent on technology and they feel very comfortable, working with the different RPMs, so that they can see it and they can have it uploaded, onto their iPhone or one of their smartphones. But do they have the smartphone? Or are they still working off of a tablet? I mean, are we providing them with those things? So it's a matter of assessing and having that capability and who's going to partner with you to help them get that in there. Whereas your lower risk folks, Again, they might be very high tech, and so you're going to want to make that as available to them. And some of the Medicare Advantage plans have it where, you know, they can provide it because they have done well on their star rating, so they have additional funding coming in. So they're going to expand that, and they're going to offer those kinds of things to those seniors to help with that. I think that's, you know, that's how I would tackle it: is know your population, risk stratify, know what your outcomes are that you're going to look for. You know, when I'm looking at that population for disease management, I'm looking at, you know, what are my readmission rates? What are my clinical indicators? What is my patient experience? You know, how am I going to influence that, and then build that program and build those mechanisms in there. We did that, you know, with a Medicaid plan, where we did it with the primary care providers and put the diabetes monitors in those hands of the members. And, you know, because it was managed through that provider office, we were able to show, you know, decrease in inpatient, decrease in ED, increase in pharmacy utilization because now they were taking their medicines, improved A1Cs, improved different types of, you know, picking things up early. So you're slowing down the kidney disease so that you're picking up neuropathies early. So again, looking at that population and then deciding who best to partner with. And as a plan, that's what you're going to look at is, you know, where do I provide it independently and who do I need to partner with? And then what kind of agreements do I need to set up? You know, is there a value-based purchasing agreement that needs to be done that would encompass, you know, just a one-time per member per month type of fee for these things? Or like if you're doing straight Medicare, are you going to be billing some of the codes? So it's, you know, different things that you have to take a look at. Who is that population you're going after? And then, you know, the other methods that I mentioned.
Yeah, I was going to go down through Medicaid and also Medicare, but also Medicare Advantage. I know that this is being deployed through HCBS contracts, through Medicaid, and also through Medicare as well, and through some of the reimbursement. Do you think that remote patient monitoring or PERS would be offered through Medicare Advantage plans that are out there?
Oh, yes.
Is it being offered through Medicare Advantage plans today?
Definitely.
Okay. But not universally across.
Not universally, but, you know, again, it depends on how they're going to fund it.
Right.
So, you know, is it something that they're doing well, or they want to improve their star ratings, and that could be a method to help improve their star ratings? Right. Or is it going to be a grant that they're going to give a provider because, again, that provider has a large population that is having difficulties with those cost reductions. So this is going to be how they're going to look at working a strategy with them, and it's going to be part of that platform then.
Okay, John, let's go back to you really quickly. So you've been, you know, a CIO, CMIO, you know, of major health systems that are out there. You know, I've kind of asked this before, but are the providers ready for patients to be remotely connected into the home? What is your thoughts and vision of hospital at home? Do you think hospitals are going to be building these big monolithic billion-dollar campuses in the future, or do they see the home as a logical extension of their campus?
I don't think, Ken, that you can generalize what health systems are eligible to do or capable of doing. I think it's specific to the health system itself. I see some that are more advanced than others that are actually taking advantage of this hospital at home kind of movement, and they're starting to reshape what their future hospital looks like or their future medical office building looks like, and kind of shrinking it down and, you know, getting prepared for the fact that a lot of the care might be done in a home base, right? I see other hospitals that are basically ignoring that trend, right? And maybe not as progressive and more concerned about, if I do care for someone at home, at least under these temporary regulations that we've had during COVID, are those going to stick, right? And if I do care for someone at home now, how do I put a head in that bed that I just emptied because I pushed someone to a home-based care model, right? And I think a lot of it has to do with how much risk the health system themselves was willing to take on. You see some that are more progressed in the ACO kind of space, and they're in the risk kind of space, and they get more progressive in what they're willing to do with home-based care. I think a lot of it comes down to how are we going to reimburse, and how progressive is the system going to be? Are they on the leading edge of capabilities? And I'm not sure we'll see it as a full movement across all service lines in a hospital. I'll give you a great example. About 3 or 4 years ago, I came across a company that's working with us and build out this monitoring mechanism so that anybody that gets a transplant can be discharged from the hospital early and be monitored at home. And they're getting readings from multiple sets of devices, and they're using analytics against those to help them temper the drug protocol to determine, to not have organ rejections, but also not to get the secondary infections. And they're seeing some great results there, but you would never know the name of the company because it's white labeled under some health systems as a service line that they're on. So I think we'll start to see it progress a little bit, sometimes more as a service line in some of these health systems. I think there's some that won't ever get there. Right. I think there's some that are just so far behind that that I'm not sure that they're going to make the progression.
By the way, the company you mentioned, I did meet with them yesterday when they were here in Phoenix at the conference. So it's a great company.
Okay. Yeah.
Right.
Yeah.
The open question really quickly for you is it's not a 2-hour response, but not that you're giving those, is why is Microsoft into healthcare, right? From that. So why are they going to become an EHR here in the future, or what's their position in the ecosystem?
So I think it boils all back to the mission statement for Microsoft, which is to enable people to do more with technology. And we see healthcare as a place where we really can do that. We see there's a lot of tools and technologies that are needed to bridge the gap from where data exists today and where it's being managed today to the kinds of experiences we see in other industries, right? Let's be honest, healthcare is an industry that doesn't provide its consumers an experience similar to what they find in other industries. And those experiences aren't progressing as quickly, frankly, as they are in other industries. And what Microsoft really wants to do in this space is bring the technologies we're seeing help other industries progress those experiences along into healthcare. Does that mean we have a future as an EMR, EHR? Probably unlikely. We tried that at one point in our history, and we learned that we weren't really solid at that. But there's so much more to the needs of communication and all the technologies that are needed to run a healthcare model outside the EHR that we think we can help augment. Right. And even with those EHRs, you can bring them over to our platform and we'll run them for you and make it much more scalable and those types of things as well. So
I got to say, I personally love being a partner with Microsoft, on the initiatives you're doing, us connecting to your platform and being what we say on the other side of the digital front door inside the home,
yep.
Right? To bring data in is just, I think, working perfectly. So we love to have you as a partner. I was going to ask Geoff really one question. So in looking in the future on this, I know we're going to wrap up here soon, is where do you see, that you can discuss Medical Garden going? What innovation and thoughts are you thinking of where you ultimately want to start driving the company and your relationship with your subscribers?
Well, it all comes down to creating more value and at the same time driving costs out of the system and better outcomes for patients. And that starts with penetrating what I mentioned before, which is penetrating the needs more and creating a situation where 3, 4, 5x the amount of seniors living alone today are protected or protected in the future than they are today. And we plan to do that with services. We believe that product progression has been very important to the growth of the category in our own business. We have desires to be much larger than where we are today, but certainly be better at what we do and provide an end-to-end customer experience that's superior to what they can get anywhere else. We think we only do that with a service layer that is really not in place today, and that's beyond emergency response and being reactive, but rather being proactive and using data and analytics to provide better outcomes. And so that's everything from vitals monitoring to wellness checks, which we're starting to do today. So we can check in on a patient. We can use humans to do that. We can use AI to do that, which is great. Be able to convert those responses and send those over to personal and professional caregivers and other groups that are monitoring these patients at home, which is very helpful to getting in front of any declines, whether it's sleep or physical or similar. And then there's a number of other helpful services at home that we believe providing, and a lot of alignment with home care. So the nice thing about 24/7 home care is, or not even 24/7 home care, is they have humans who are equipped to care correctly for someone in there with them. They can't be there all the time, and there certainly needs to support that. We believe technology is going to step in and play a role. So our future is really about, and I'd say the last 10 years have been about product evolution. The next 10 years are about service evolution, and being able to extend the life in the home for not only 5 to 6 or 10 years longer, but to be able to enhance the quality of life in home. And that goes beyond just reacting to when something bad happens to them, but also just getting in front of any issues that inevitably creep up at this period of their lives.
So when you start, building upon a stack, I assume you're going to start reaching out to partners, right? To partner with it. You're not going to organically build it all potentially yourself. But the question on this is, and you can answer that question, but the question with this is on RPM, the data's got to go somewhere. So is RPM going to be more about self-management, or be giving tools to the family to monitor their loved ones, health and well-being? Or do you also provide a clinical staff, or do you have a partner that provides clinical staff to monitor on their behalf? You're thinking as far as the RPM side.
Yeah, I think clinical staff is certainly something that we're talking about now. And I think, when rather than if is probably the discussion, and ultimately likely to start with someone and partner, but, could get to the point where, we have a part of our call center that has, nurse practitioners monitoring these patients. And that's exciting for us to consider. I think when we talk about enhanced quality of service, it really does not mean utilizing technology for every capability. We believe strongly that the service infrastructure, which at the center of that is patient, empathetic, knowledgeable, caring people, is the differentiator in our business, and what we've spent 17 years getting really good at, and what we want to continue to perfect over time. So that's if that answers some of that question, I think that's an indicator of how we're thinking about things. We can make products that are unique and superior in the marketplace, but we can't stop the big tech from developing lower cost, feature-rich solutions. But it's really the service and the care that comes along with those solutions that really provides true value. And that's where we think is very difficult to replicate. We think in a niche market like this, we provide a competitive edge.
And I would assume, you've got the MG Move, which is pretty slick. I would assume that you'd be looking at potentially other ways to engage subscribers that are out there, ones that may want to engage another way, maybe through smart TVs or through voice assist. There's a lot of people that are doing stuff through voice assist.
I think voice is very exciting. Yeah, and it's having something for everyone, right? I mean, historically in the market, both in the products themselves and the marketing positioning, it clearly people disqualified themselves for different reasons. And it really is at a certain age and a certain lifestyle, everybody should have something. The question is, can we figure out the right solution so that everybody and the payers understand that as well and see the value in it? And, there's no question that smartphones are, highly accessible and utilized. It's all about utilization, and they're utilized by seniors, and it's moving very quickly. The question is, are they a reliable, dedicated source for the type of services that we've provided in the past and are going to continue to provide in the future? I think for some people, they certainly are. For others, that's going to change over time. But, we plan to be in front of that.
That's awesome. Donna, let's go back to you really quickly. I know you've got, a question from the audience that you wanted to, to entertain.
Oh, they wanted to know what RPM was, and that's remote patient monitoring.
Okay. So, from your perspective, do you see that people truly understand what remote patient monitoring is? right? Or is there a big education that has to go in with your members?
I still think there's a lot of education that needs to go in, and a matter of, how it can easily work into their lives, into the patient's lives, into the provider's lives, so that it's a tool. It's a very valuable tool.
And the question, another one's coming in is, can you talk more about seniors accepting these types of solutions and how you overcome their resistance, right?
It's right. And that's about relationships. So, that was important that when we were doing the care transitions program, that we actually met with that person while they were still in the hospital, explained to them what we were going to do and set up that equipment, and then take it out to their home. And they had a nurse, they had a community health outreach worker. The same thing in the provider office. We met with them in the provider office and then sent somebody out in the home if they needed help. So it's that relationship that has to be established. I agree with you 100%, Geoff. It's having that relationship and that capability to communicate back and forth easily to resolve any issues that come up, or it's not going to be used.
Right. John, what is Microsoft doing to try to make technology more consumable by the consumer, right? Usable.
Yeah, so we are not in the market of wearables and things like that, but what we're doing is we're trying to get to the point where our capabilities make it much easier for you to collect data up from those kinds of technologies, to be able to move that data easily. We're also, I told you earlier on in this conversation, we're also looking at how do we get bandwidth places, because just even getting to a rural area, communications networks aren't there. And so we're doing some work in that space as well. But a lot of it's really about when the tool or the technology at the house generates a signal, how do we capture that, make sure we manage it appropriately, get it back to the attention of the people need to see it, and actually not flood them. You don't want to hear you don't want to hear reporting coming back that says everything's fine. You want to look for the anomalies. So how do we add capability in there for analytics so when the anomalies are occurring, you can then respond to those. It's all that tooling and platform is the types of things Microsoft's doing. And then the last thing I'll throw in there, which we find very important, is common communications tools like our Teams capability and things like that. Our ability to actually use that in homes with people to communicate is extremely important. We're starting to see that be adopted pretty heavily across the market. In fact, Teladoc recently announced that they're making all their interfaces Teams-based for their technology stack. So the front end will be built on some of our technology. It'll look just like common web pages and things you normally use for telehealth visits, if you would. But the back end where the doctors work, it's going to all be in a Teams construct. So we're starting to see that communications platform be really, really interesting. And then the tools to bring the data to the communications platform. That's where we're really focused.
One thing, we're going to wrap up right now, but one of the things that, I was impressed during a conversation we had just probably a couple hours ago was the Microsoft team we were working with was really observant and sensitive to cultural adoption, right, as well. And in fact, we were talking about, I brought up the fact that Navajo Nation, how we actually helped put Navajo on one of our devices to actually help with adoption, right? Speaking Navajo back to them from it. So we're going to wrap up, John. Is there any parting words about, combining PERS and RPM and transitioning care to home, especially from the Microsoft perspective or your experience?
Well, I think that you're both in great spaces, Geoff and Donna. I think that we're actually going to see a lot of evolution in this space. I also think as people that were digital natives start to age and get into this kind of space, this is going to become a much more natural stance for them. It's not going to be trying to convince them that this technology we're trying to provide them is going to help them. They're going to be asking for it. So I think we'll see a generational thing happen here that's going to allow us as a group of our generation's age, we're going to see this just be a natural thing that happens. And it's not going to be something we have to try to figure out how to get them to adopt and those types of things. It's just going to happen naturally. I'm already seeing that a little bit with, as I'm starting to age, my kids started talking to me about what I'm going to do when I get older. And well, I wear a device because we had that struggle with the grandparents, right? Wouldn't wear a device, couldn't get them to do it. It was, it was a start to admit that they were old, basically, and they were struggling with it. So my kids and I have already started that dialogue. So I think you'll just see larger and larger adoption of it, frankly.
Awesome. Geoff, what's your parting thoughts about bringing it together?
Well, we're at this inflection point where we've all experienced COVID the last couple of years. It's advanced technology and our awareness of technology and other types of services. And certainly when you talk about seniors in the home, who are in some cases scared to go into any type of independent senior living facilities, their attention turned quickly to how can I utilize technology better, whether it's video conferencing with doctors or nurses, or monitoring their vitals, or having a help in an emergency. It's a pretty exciting time in the sense that we have an opportunity to get people protected and healthier quickly and at home, where 95% of them want to be living for the rest of their lives. And so, and when we talk about payers and health systems and home care and RPM and PERS, you're seeing the convergence of a lot of these types of organizations. And in the last couple of weeks, even through acquisition, when we talk about how do health systems feel about, breaking through the walls of the hospitals and into the homes, Advocate Aurora buying Mobile Help in our category is certainly an good example of that. Certainly we see groups that believe that way. And with payers like UHC and LHC, the home care organization, coming together, there's a lot of crossing over that I think is going to lead to lots of opportunities, and ultimately flows down from the top of the food chain to a very positive outcome for patients of all kinds. And so it's just a great point in time in healthcare, and these bundled services are going to drive a lot of that.
Thanks, Geoff. That's great. Donna, your parting thoughts.
I just want to end with a story. So as I've listened to everything, a lot of this has to do with, how well someone adopts to and adapts to this different technology. And, John, you brought up about your parents. Well, I know I had that challenge of getting my mother to use that home system, the alert system. And after I got it all set up, and then I talked to her, and she was convinced to do it. And she agreed, because she was afraid now of being alone. And what was amazing is she turned out to be one of the biggest advocates. And she showed everybody at church. And anytime they had somebody that didn't want to do that, they would say, well, go talk to Dorothy. And, she would talk to them about, how she checks in every day, how she does this, how she does that. And by all means, she was not anything technology oriented in that capacity, but it was a sense of well-being, and that she still had that empowerment over herself. So I think it's as we blend all this technology, let's not forget about the people who are using it and how we engage them to help us, get it out more, because they will, with the equipment, with the remote patient monitoring, with the PERS system, they will, as long as we make it easy for them and we have that support system for them, it'll happen. It is happening.
That's awesome.
It's not a sign of getting old. It's a symbol of empowerment, as we
Exactly.
say.
Exactly.
We see it every day, all day long, within our own families too. My father-in-law is 85, wears this watch and absolutely loves it. Has had falls, has had every different kind of device we've had, but didn't take the certain devices like so something for everybody's important. That's a great story. Thank you for sharing.
Hey Geoff, I'll end with a little funny thing here. My kids, when they talk to me, I tell them it's not a dad body, it's a father figure. Right? So, it's all in the way you look at it. It's all in the perspective.
Right.
Yeah. Well, these are great stories, and I want to thank you guys for being here. One of my wishes, though, in this industry is we stop calling it RPM and PERS and virtual care, and we just call it healthcare, right? Yeah. So it's just part of what we're going to be doing, right? Mm-hmm. So I want to thank everybody for attending this evening. Thank you, Donna, John, and Geoff, for your participation. Great insights. We'll post the recordings on newnormal.buzz probably this evening. Our next episode is titled Bringing the Best Care to Our Vets, especially in Rural Locations. Dr. Wise, CEO of Valor Healthcare, Joel Bartholomew, CEO of Global Med, and Admiral Rob Ray from Blue Star Senior Tech is scheduled for next week, the 20th. So we hope you'll join us. You can find the registration details on newnormal.buzz, and have a wonderful evening. Thanks, everybody.
Thank you.